Hi, welcome to our last lecture and our chapter on tissues. Now, this information is not really described at all in your textbook, so it's really important that you get all the content from this lecture. So we're going to look at tissue injuries, and we're going to talk a tiny bit about repair and focus more on repair back in the next unit. But when we have tissues, we have an injury that occurs, we have to have this response to maintain homeostasis. We mentioned homeostasis and how critical it is, and this response is called the inflammatory response or inflammation, and it is a very critical defense mechanism or critical first defense or response against any kind of harmful stimulus. So I'm just calling it an injury, but this could be anything that could be, it could be a pathogen, it could be damaged cells, it could be toxins, it could be irradiation, but some sort of harmful stimulus is applied to the body. And so the immediate response is inflammation or inflammatory response. And it's critical because it's going to isolate the area to try to prevent further damage, and it's going to initialize the healing process. So when you hear infection, infection just means the presence of pathogens in your body. And when we look at inflammation, there's some typical signs and symptoms of inflammation. Now, we're going to focus on the acute inflammation, the short term, what I was just talking about, that beneficial response to any kind of injury. Chronic inflammation, however, is not good. It's the cause of diseases, and we'll talk about those near the end of this. So when you have an acute damage, you have this inflammatory response. There's 4 classic signs of inflammation that occur. So some sort of harmful stimulus occurs. We call this the injury. We immediately go into inflammation. So the 4 signs of inflammation, again, you'll see, and don't fill these out in your table yet because I'll go through them in order, but we're going to have some pain, swelling, warmth, and redness. So classic signs of inflammation. So when you have this injury, what's going to happen? Why do we get all of these things happening? Well, a bunch of chemicals are released. And so these chemicals are released from damaged cells. They're also released by white blood cells that we'll talk about shortly. And you have some of them listed in your notes. You have histamine and heparin, prostaglandins, which are kind of like hormones. And then you have these cells that we talked about in connective tissue, the neutrophils, the macrophage, the mast cells. And these chemicals are just kind of generically called cytokines. So cytokines are inflammatory proteins, and they're critical because they're going to cause these 4 signs of inflammation. So what exactly causes each one? So now we'll go to your table, and you'll see the first thing talks about chemicals cause vasodilation of blood vessels that increases blood flow. Now, we have injury, right? These chemicals are going to be released, and I mentioned a few of the chemicals. These chemicals cause a couple of things to happen. One thing is they cause dilation. So we say this is called vasodilation if we're talking about a blood vessel. So your blood vessel might normally be that size, and then it enlarges. So when it enlarges, then you can understand that more blood can get to the area because now the lumen, which is the hole, the inside, increases. Well, when blood flows to an area, it causes a couple of things to happen, but it's going, and you'll see the first 2 have the same thing because that warmth or heat, I usually just say heat, and redness are due to that increase in blood flow going to the area. So these are your classic signs. In fact, it'll look pink. It might feel warm to the touch. Now, the other thing that happens is we're going to start to get all this tissue swelling. And so the swelling is because the blood vessels become leaky. And so when we look at increased leakiness, right, we see that they increase their permeability. Remember that permeability is basically how leaky, how easy it is for materials to move past, basically between cells. So become more leaky. And so cells can move into the area, more fluid moves into the area, and that's going to cause a swelling. And the main chemical that makes them leaky is histamine. And you probably remember that histamine is released from the mast cells, and the mast cells is what they were called in connective tissue. Now, a couple things unfortunately cause all that pain that you feel. One is the swelling, because the swelling puts pressure on nerve endings and triggers pain, basically pain information to reach your brain. There's also chemicals that are released by damaged cells that cause pain, and there's prostaglandins and one called bradykinin. Now, there's many other ones. I'm just giving you a sample But what happens when we take, and we'll talk about this at the end, but when you take you take Tylenol or you take Motrin, they basically interfere with forming these chemicals, which is why they help with the pain. This is why we ice, right? If we ice, then we're going to help decrease the blood flow to the area, and we're hoping to reduce the swelling. So this doesn't feel very good, but it's very, very important, as I said, that it happens. So why is it critical? Well, number one, increasing all that blood flow and fluid can dilute any toxins that might be present. Increased circulation can remove waste products. When you bring more blood, you bring more oxygen and nutrients to your fighter cells. In fact, some bacteria are anaerobic, so bringing more oxygen can be protective in and of itself. You're going to bring more cells to the area. You're going to bring more of those phagocytes and macrophages. In fact, the first responders are called the neutrophils. And we talked a little bit about these. Neutrophils are a white blood cell, and they're going to show up first in their phagocytes. They're going to eat up debris and clean the area. The heat increases temperature, which is important because we know that if you increase temperature, you increase the rate of chemical reactions. And a lot of these are chemicals being released, so it makes your immune system fight better. It can bring antibodies to the area. Antibodies are proteins that are in your blood. Think of antibodies as your body's army. And you can also remove toxins and waste. So this is kind of similar to the other one. You dilute it and you remove them. I kind of have it in there twice. So those macrophages, neutrophils are a specific type. They're there to eat up the cells, eat up the debris. And what happens is these neutrophils show up pretty quick. And when they get there, they start eating anything. And as they take in the contents, they actually rupture and pop. And so you might remember inside your cells are lysosomes. These are organelles that are inside. So when a macrophage takes something in, it can go in this lysosome, and they have those enzymes that destroy things. Sometimes they're called the suicide sacs. So they're inside the macrophages, and their job is to help destroy what they eat. But what can happen is those cells eat so much they literally pop, and then you start to get a collection of cells and debris, and this is what pus is known as. Now, if we have pus, I'll circle it in within the body, your body will naturally break it down. However, we don't want it to become encapsulated, because then you have what's called an abscess, and there's nowhere for that to go. So if you have an abscess, a lot of times they'll drain it. Sometimes if you have surgical procedures, they'll put drains in to try to help all that pus, those dead cells, have a way to escape. Now, when you hear the word necrosis or necrotic actually means that the tissue has died. So necrotic tissue will no longer work, and that's the tissue that, if they're depending on the wound, that they might be cutting out or removing. So as far as repair goes, what's going to happen is there'll be a time frame between when the inflammatory system is kind of slowing down, the inflammatory response is slowing down, and you start to repair the tissue. So the stasis just means standing. It's kind of like a standstill, slow down the blood flow, inflammation slowing. Now we're going to try to heal the area, regeneration. So when we're trying to regenerate and heal the area, there's two ways the body uses. It's called regeneration versus fibrosis. So regeneration, let me get that off, is when the tissue is actually replaced. So the tissue is replaced with like tissue, and it usually functions perfectly fine afterwards. So epithelial tissue is classic for regeneration. Think of all the cuts you've had on your body and how they're healed. Connective tissue also regenerates really well. Sometimes you have an area where you start to get this scar tissue, and we'll talk more about that when we look at the skin healing. If you have a scar, it might look white because of all the extra collagen. So what happens with fibrosis is a lot of times you end up putting collagen down. And collagen has its own characteristics. The area won't work the exact same way. And so you might see this scar, which usually looks like a whitish color. Now, when we're looking at regeneration, again, the best ones are epithelial and connective. Know that skeletal muscle has some ability to regenerate, and so does smooth. Cardiac muscle cannot regenerate. So if you have a heart attack, you always have damage. Okay, that area has scar tissue and it never works the same way again. And if we look at nervous tissue typically heals through scar tissue as well. So I mentioned we were looking at the acute phase, which is very, very important. However, we look at chronic inflammation. It's the heart of many, many different diseases. So, acute, important to occur, but what we don't want is to turn into chronic inflammation. And you can see a bunch here. I'm only going to focus on 3 in particular. So the 3 are arthritis, asthma, and something called colitis. So when you see itis on the end of a word, it means inflammation. So that's always a hint that something's going on. And arthro, you might remember, means joint. So arthritis is when you have inflammation in a joint. And what happens is that articular cartilage that we talked about, you might remember, what kind of cartilage is that? It's hyaline cartilage. So the type is hyaline, but it's called articular because it's on the ends of bones and joints. And so that synovial membrane we mentioned a little bit can become inflamed. The cartilage breaks down, and it's a lot of joint pain, and that's from inflammation. Now, asthma has 2 things going on. You have inflammation, so you get kind of inflamed bronchi, and you get swelling, increase of mucus. When someone has an asthma attack, a lot of times it actually constricts as well. But a lot of people with asthma have to take daily medication to try to treat that inflammation. And then colitis is when you get inflammation in your large intestine. And so it's associated a lot of times with inflammatory bowel disease. So you can have intense cramps and pain due to that inflammation that occurs. So what do you do for inflammation? Well, we touched on this briefly. If it's something, like you fell and got hurt, or you twisted your ankle, or you rest, right? First thing is just give it a break. Stay off it, try to rest it, let your body do its thing and heal. We know that we ice because what happens with ice is initially it decreases blood flow to the area, so it's going to decrease the swelling. We know omega-3 fatty acids. You can eat your salmon and your tuna, or you can take them as a supplement. These have been proven to decrease inflammation. So, maybe you go and you have a really hard workout, take your omega-3 so that you decrease the muscle inflammation that makes your muscles sore the next day or 2 days later. So these help with inflammatory general inflammation. Also, we know they help with keeping our blood vessels cleaner and helping reduce our risk of heart attacks and strokes. Now, if you're in the acute phase, you probably want to take something to block those inflammatory chemicals. So your NSAIDs, non-steroid anti-inflammatory drugs. So this is your ibuprofen, your naproxen, aspirin. These are the main ones that work for that. And obviously there's risk for taking these. Ibuprofen and naproxen can be tough on your liver. So can Tylenol, but Tylenol doesn't seem to work as well as an anti-inflammatory. So these are taken, they block pathways. I'm not going into the pathways, but they prevent those inflammatory chemicals from being formed, or they decrease the prostaglandin formation. Aspirin blocks the formation of a prostaglandin. And I haven't said a lot about prostaglandins, but they're hormone-like, meaning that they are released and work in the area they are released. So they're like a local chemical that controls the area it's released. Now, you might need to actually do a corticosteroid. So corticosteroids all come from the hormone cortisol, which you may have heard of. So it's a hormone. It comes from your adrenal cortex. Remember, the adrenal glands are above the kidney, and there's an outer portion called you're going to learn this later anyway, so you may as well learn it now, cortex. And so prednisone is a derivative of cortisone. And so prednisone, corticosteroids, we know that they're very, very good at decreasing inflammation. They decrease a lot of things for your immune system, which is why you don't necessarily want to be on them all the time, because they suppress your immune response. However, if you have asthma, you might have to take a daily corticosteroid to decrease that inflammation, because breathing, right, is more important. Or they do injections where they can put it right in the area. Now, the concern when you're starting to get these injections is that some people get the injection and it makes the inflammation subside so much they feel better, but they run right out and exercise again. Well, you don't want to do that. You need to make sure you rest and give your body time to heal as well. And if you take the corticosteroids for a long period of time, like I said, they can decrease your immune response, make you more prone to illnesses. They also, over time, can break down bone. So you just want to be careful and not overuse those. We also know that there's a inflammatory protein. Again, there's many proteins. I didn't touch on them all, but one in particular is called C-reactive protein, and this one goes up during inflammation, and it can be measured from a blood draw. So sometimes doctors will order this because they'll try to see if it's very, very elevated. It shows that there's inflammation going on. And I touched on the omega-3s helping with inflammation when we're looking at heart disease, because one of the first steps in, you've probably heard of atherosclerosis, is when your blood vessels start to get narrowed with plaque and fat, is we know that the inflammatory response plays a key role in this. So if C-reactive protein levels are elevated, then that could show that you have an increased risk of heart disease as well. And I just want to define some terms. When we look at tissues, there's words that we use to describe different types of either increased size or increased growth. So we have our normal tissue right here in the middle. Okay, that's what it should look like. Notice we have 4 cells in this fake tissue. Now, if those cells were to get bigger, we say hypertrophy. So I've heard it pronounced hypertrophy and hypertrophy. So this is when cells get bigger. So when you exercise, your muscle cells hypertrophy. In fact, pretty much any cells in your body can get bigger with being used. If you don't use them, they atrophy. So if you have a cast on a limb, you might notice that the arm, we'll pick an arm with the cast, those muscles actually atrophy and look smaller when the cast comes off. Now these other ones, notice that we're looking at more cells, and look at what the cells look like, right? We have our normal cells, but they start to change a little bit with what they look like. So hyperplasia is an increase in cell number. Now this happens normally, we know that when that muscle cell can make more muscles when you exercise. So you actually increase the size of the muscle and you have more cells, so your muscles get bigger. So hyperplasia occurs in certain tissues. Remember when we have mitosis that we're trying to only replace the cells that die. So we try to keep everything about the same when we look at this hyperplasia. But usually the cells are fine, there's no issues. Now, if you look at this metaplasia and dysplasia, notice you're starting to see a little bit of changes. So we're going to go to this picture because I think it describes it better. So we have what's called metaplasia, dysplasia, and anaplasia. Okay, now, if you're a female and you've had pap smears, you may have heard of dysplasia before, because dysplasia is, notice the cells are starting to change. So when you see dysplasia, you are having abnormal cells. It's sometimes called pre-cancer. It's not cancer. It's a sign, though, that cells are changing, and it's reversible. So a lot of times they'll do a biopsy, and they might find dysplasia, and then they might go in and remove the tissue. So dysplasia is considered a pre-cancer. Then we go into what's called metaplasia, and we have metaplasia, and then we have, which also anaplasia. I just realized I don't see that in this picture. So metaplasia and anaplasia are more substantial changes that occur. If you look at these cells, look a little bit different than those cells, but in metaplasia, it's still reversible. So a smoker will probably have a change in their epithelial layer because of the damage from the carcinogens from the smoke, and the cells start to change. And again, this would be visible on a biopsy. You stop smoking, the epithelial heals. Anaplasia is changes to cells, but it's irreversible. So this is technically over here supposed to be showing you anaplasia. So what happens is now you have cancer. You have a tumor, it's abnormal, and it will never go back to the normal. So when we treat cancer, we hopefully can just take the tumor out is the best way, but we also know that sometimes it spreads. So before I get to that, remember we have carcinogens, and you learned about these a little bit in Bio 119, but these are just common causes of cancer, right? It's all around us. We know smoking is the #1 cause of every single cancer. We know that what we eat affects us. We know, notice it's a lack of exercise. We know there's genetics. So there's lots of carcinogens around us. There's some we can change and some we can't change. But when we develop into this cancer, we have what's called a carcinoma. So carcinoma means you have basically cancer. You have a tumor. And so that tumor can vary. If it's in situ, it just means that it's encapsulated and it's not spreading. So sometimes we call these benign tumors, and because they usually have a capsule or they're not going anywhere. So those can be removed usually, and sometimes you just leave them alone, and sometimes you go in and surgically remove them. Now, if it spreads, now we have cancer. So that's called metastasis or metastasize. And so remember, these are your own body cells, right? It's your own cells. They have your same genes. They release chemicals that can break through that basement membrane and can break through. So a carcinoma, by the way, is an epithelial cancer. So it's just kind of like a generic word when we're looking at anything that affects epithelial tissue. If it breaks through the basement membrane and gets into connective tissue, now it's going to spread, and now we have cancer. So this concludes our last lecture for Chapter 4.